Welcome everyone to this episode of On the Front Lines, where we'll be speaking to Rajesh Srinivas of Sangama uh, on the issues that sex workers and transgenders are facing in the wake of the COVID-19 lockdown. Rajesh, unfortunately, has lost access to the internet, so he is with us on the speaker of my phone, so you'll be able to listen to him, but you'll not be able to see him. So, welcome, Rajesh.
Thank you so much. So, unfortunately, I'm speaking to phones, so because of some technical issues here.
Yeah.
So, thank you for having me.
Thank you so much, Rajesh. Before we start, just a quick housekeeping rules. We are live on YouTube, Facebook, Twitter, and Twitch. You can put in your questions on the comments box in all of these platforms, and we'll make sure to ask Rajesh these questions. And as always, stay with us. So, Rajesh, let me begin by asking that the COVID-19 situation has put at risk many vulnerable populations, including children, women, who are facing abuse or domestic violence. What is the situation with transgender and sex workers?
I think one of the important things is both transgender people and sex workers have been invisibilized. So these are two marginalized, vulnerable communities which have been forgotten in this pandemic. And I think one thing which we need to remember is both these communities have been stigmatized. This is a stigmatized community. So forget COVID-19, but even in terms of regular access to public health services itself, there's a lot of data which is coming out how these communities were stigmatized and being discriminatory at the healthcare sectors. That is the first point. The second point is even in terms of at the policy level, in terms of reach out from the governments, there's not much happening. I can recall two High Court judgments. One is the Karnataka High Court judgment, and the other one is the Jharkhand High Court judgment, if I'm correct, that kind of said that there should be some benefits towards trans people. And in Karnataka, we are seeing that some kind of dry rations have been given. But for sex workers, I think till about yesterday, there was not much kind of happening because sex workers is also one community which is part of the unorganized sector. So they're also workers. So what benefits which are kind of being rolling out to migrant workers, whatever little it is, because we know there's a lot of issue even with migrant workers also, but with sex workers, it's been completely kind of left out within this entire kind of policy reach, which has been happening for other communities. So that is where the problem lies.
So, Rajesh, there's been, you make an interesting point that these communities are also part of the informal sector. And the government has announced a package in the past with respect to people in the informal sector, people in the construction industry. Was there any reference to these communities during the announcement of this package?
No. So initially, when I kind of looked at the documents, it only spoke about informal workers, and that's so. I think last night there was one document which I received from the Karnataka government where they specifically mentioned trans people and sex workers, and they also mentioned. I'm only quoting the language which they've used, like beggars, destitutes, and other marginalized communities. So now we have to see at an implementation level what does that mean in terms of reaching out to services, just not ration services, but in terms of medical services and all of that. So yeah.
So quick for our viewers. Are you saying that trans people and sex workers are classified as beggars and destitutes?
No, I'm not saying they're classified, but there was one directive which we had received as of last night from the government of Karnataka, and they had mentioned these communities as vulnerable communities where the district collectors should also kind of provide them support. So that placed all of them in one kind of umbrella. So
okay. So what is in a normal sort of circumstance, what is the kind of work that these communities do? And how have they been affected?
Okay, in terms of normal circumstances, I think for trans people, and here I'm primarily referring to trans women or ijdas or the multiple other terms which is being used in India. I think for them, in terms of that, there are only two options because of lack of employability options, it's either begging or sex work. That is where the livelihood for trans women is. For trans men, it's even more difficult. Some of them work as drivers and part of the other unorganized kind of sector, and they are kind of difficult. For sex workers, and here I would like to define sex work, because in popular culture, one of the understanding with sex workers as people who kind of sell their bodies, and that kind of definition kind of keeps coming up. So I think we need to kind of debunk that, because sex workers are people who provide sexual services, and we see sex work as part of a labor construct, as part of work. So it popular, and this is what people do for livelihoods in terms of normal time. So either you work as in begging or in sex work for trans people, or you're part of the unorganized sector, or some of them would have been employed by your community-based organizations which are implementing your HIV intervention programs or your NGOs.
So could you expand on the difference between sex workers? I mean, you said that they are the ones who provide sexual services.
Yes.
And you said that in popular narrative they're just seen as prostitutes.
Yes.
So what is the range of sort of their engagement with society?
In terms of in terms of now, sex workers are people who provide sexual services, right? Now in the sex worker industry, there are multiple kind of places. You have sex workers, you also have agents, and I'm not using the term pimps because it's a bit stigmatized. You have agents who kind of provide clients. Then you have what's commonly referred in parts of the northern part of India as the garwalis, or commonly referred as madams, who kind of take care of brothels. So within that, people kind of play different kind of roles.
Okay.
Yeah, but basically it's providing sexual services in exchange of money.
Okay. So a large part of their work seems to be focused on public spaces.
Yes. In Karnataka, it's primarily public spaces, because more than 90% of sex work in Karnataka happens with the street-based, because Karnataka don't have a culture of brothels when you compare to other parts of the country. So
okay, and so because of the pandemic, that entire space is lost, because
that entire livelihood has come to a standstill, right? For somebody to move, so for sex workers, you would need clients. And now, because of this lockdown and because of these issues, there's been complete kind of shut of livelihood. For trans people, because they have to go for begging either on trains or on streets, so that has kind of taken a massive hit. So that has been one of the major kind of issues. So their earnings have actually become nil, absolute nil, is what we have been, the narratives which we are hearing from the ground.
So as you speak, questions have started coming in from the audience. Yeah. And one of the first questions we've received from Arindam Biswas is that, is sex work legal?
Okay, good question. Now, this is the thing. In India, sex work is neither legal nor illegal. So to simplify it, there's certain aspects of sex work which is illegal. For example, in India, you cannot solicit. So soliciting is illegal. Keeping a brothel or about 3 to 4 sex workers come together and do sex work in a brothel setting, that is illegal. Parents, children living on the earnings of a sex worker, that is illegal. So there are only certain aspects of sex work is illegal in India, but that is effectively kind of going towards criminalization. So one of the demand of the sex workers in India has been for many years is going towards decriminalization of sex work in itself, complete decriminalization of sex work.
Let me reverse the question and ask you, what parts of sex work is legal in India?
Okay, so for example, I can be a sex worker. I can provide sexual services.
Okay.
And that doesn't stop me. But the trick there is you cannot do it within 100 meters of a public important space. Like you can't do it near temples, near schools, near public buildings. So basically to kind of push sex workers away into the peripheries, or just saying that no, you go and do your sex work in forests or somewhere far away where you don't get clients. So yeah.
Right. So essentially, they've been. So while it's not illegal, the rules are such and the laws are such that it's made professions very difficult. This profession very difficult in general. What is the impact of this criminalization? What is the cultural context in which this community operates?
See, in terms of now criminalization, I think for both these communities, these were criminalized community, whether it's sex workers and trans people. But now trans people are not criminalized because of the Supreme Court judgment. I can talk about that later. So basically, and these communities worked in a criminalized setting. So what happens is, as communities, when you're criminalized, then your access to services gets curtailed. Then you're always under the glare, under the eye of the public, and the police. So there's kind of further stigmatization, there's further marginalization. You're not seen as citizens. So for example, the construct of citizenship, the notion of citizenship is not there. You don't get benefits from the state. I think that's what criminalized communities across the globe kind of face.
Right. So there is as it is, they're looked down upon, and even the legal space that they're being offered and the cultural context is the space is shrinking for them.
The space is shrinking for them. And one of the things, just to kind of look upon now, the COVID-19 pandemic, and one of the fears is being with this pandemic. I think if I'm not mistaken, there was a sex worker rights activist, a sex worker herself in Australia, had written this piece. Now that the worrying factor probably of COVID-19 and its impact on sex workers would be that sex workers might be further stigmatized. Because in pandemics like these, the fear that, because COVID-19 and coronavirus is also kind of impacted because that is virus. Because normally, in popular culture, if you look like in the earlier days, so sex workers and LGBT community members were always seen as the carriers of HIV disease as a virus. So this whole thing of virus, because just a couple of days back, I heard narratives in a small village in northern Karnataka where a sex worker who was living with HIV, and the people knew that she went to a ration shop, and people said, no, you don't come here because coronavirus also transmits because of people like you. So there's also that fear also now.
So you've made a very interesting point that a lot of this community already has pre-existing diseases. Could you tell us why these diseases exist in the community, and because of this, what kind of vulnerabilities do they face?
Okay, but I would not say that there are these communities only kind of get that with certain disease, but when you look at prevalence of HIV, which is the human infectious virus, HIV. So now HIV is basically the prevalence where communities are more vulnerable to HIV because of different kind of factors. So that is why a lot of these targeted intervention programs, which works with sex workers, trans people, men who have sex with men, people who inject drugs, your migrant workers, and all of these. So there's this targeted kind of intervention which is just not in India but across the globe. You have these because the prevalence rate is pretty high. For example, when you look at data, if you take about 100 sex workers, I'm just giving you one example, 100 sex workers in some states in India, you could say about 6 to about 6 sex workers who are also living with HIV.
Okay.
So people living with HIV from these communities, they're already stigmatized, they're already vulnerable. Now this kind of pushes them, because in terms of access to antiretroviral therapy, CRT medicines, which was one of the important issues, then we kind of find work with the state, and now we're kind of delivering ERT medicines to their homes in itself. So that is one issue which I can foresee. The other issue which is already happening, just not for LGBT, but this enormous focus on COVID-19, there's also a deprioritization of other health issues. Now, in terms of how is that going to have an impact for somebody who's gone into gender affirmation surgeries or sex reassignment surgeries, or who's on hormonal therapies for trans people, and how is that going to kind of impact on their health? So these are some of the issues which are already kind of struggling with.
Right. There is a question from the audience from Anukriti. Even after the lockdown opens, are there existing apprehensions within the sex work sector about their own health risks given the nature of work?
Yes, I think there will be that, but because now I'm not going to use the word social distancing, but I'll use the word physical distancing. Now, physical distancing becomes also difficult for communities which kind of lives very close to each other, right? Now, physical distancing is also a privilege. For example, for people like me who live in an urban locality, is much more easier. But even in urban areas, but if you look at slums, if you kind of look at others, and when you're living with a family of 7, 8, then where this kind of physical distancing kind of happen, that's one. I think what you would see post-lockdown, at least I don't see the livelihood kind of immediately. You will see clients kind of coming in, but then like any other work, because of nature, like any other form of work, then there has to be safety precautions. That is a complete non-negotiable, and that will kind of happen. So there's already awareness and all of that kind of going through. So in any form of work, probably in the coming months, I don't see that immediately post-lockdown will kind of livelihood kind of come back. There will be clients for sex workers. I don't see that happening, at least in the initial months post the lockdown.
Okay. So as a follow-up on this, there's an audience question which from Loy. And he says, you talk about sex work as though women freely choose to do so. But there are degrees of force and freedom on a continuum veering towards force. Where does violence and trafficking figure in this construct?
Okay. And I think that is the longest I try to kind of. Okay, now I think the problem with sex work is there's this deliberate conflation between trafficking and sex work. Now, when I'm talking about sex workers, I mean people who are about the age of 18 who are in sex work in their own volition. And just to kind of give you a data, there was a study which was done by an organization called Sangama, and they had kind of spoken to roughly about 500 sex workers. What the data showed was most of them, majority of those sex workers, kind of did other forms of labor, whether it's domestic work, whether working in a garment factory or street vendors, and then they got into sex work because sex work also kind of gave them earnings which are much better from other forms of work. So sex work per se is not violence. I think we mistake by saying that sex work per se is not violence. Yes, within sex work, is there violence? Of course it is, like any form of work. For example, look at mining industry, for example. Mining industry, nobody is going to say mining industry per se is inherently violent, or domestic work per se is inherently violent. But within that work, if there is violence, then of course that violence has to be addressed. And there has to be mechanisms and forms to address that kind of violence. So, yeah.
So a lot of sex workers have, intermediaries who sort of, get them work or livelihood. And I imagine a lot of transgender people are also involved in sex work.
Yeah.
How, what kinds of violence are they facing right now, given that they've entirely lost their livelihoods? And what might be their situation currently?
See, in terms of the situation currently is now in terms of violence, now of course domestic violence, we're seeing that because of intimate partner violence has been one of the most kind of important forms of violence. So either with intimate partner violence, you would see, or when their husbands are very abusive, and there are also those issues. So, but then we are kind of figure out ways, because all of them are locked down in kind of one house. So there would be these issues which are also kind of coming up, because just to kind of give you an example, we had received roughly about 146 calls from the LGBT community and asking us for, and we had kind of provided counseling, and some of them we had kind of referred them to professional kind of mental health support because of issues of stress, other kinds of issues. So yeah.
Okay. And with no earnings and with no income right now, Shloka Kumar is asking us how are they managing, and what exactly are the directives that you've received from the Karnataka government?
Okay, see, for the Karnataka government, I just told you there's just been one policy statement. But for transgender people, in some districts, you have the Legal Services Authority, the District Legal Services Authority, the Women and Child Development corporations are given them some rations. Sangama in itself, we are kind of providing ration support. Each ration kit costs about 1865 rupees, 25 kgs of rice, couple of kgs of dal, sugar, soaps, and other things. I think till yesterday evening, we had provided about kits to about 2,720 people, including both sex workers and trans people in about 26 districts of Karnataka. So we are kind of doing ration kits, and the government for trans people, they've kind of started. And one of the question also now in terms of the public distribution system, in terms of ration cards, not many sex workers also have ration cards. If they have ration card, because sex workers would have also kind of migrated from one place to another, they would not have documents. Some of them might have not enrolled within the PDS. At least about 40% of sex workers would not be part of the PDS system also. So this is where, and I think organizations like us, for example, the National Network of Sex Workers, which are also kind of part of across the country in about seven states, is also kind of providing relief in the ground, kind of giving them ration supports, or in cases if they require some medicines, so medicine support and all of this is also happening.
So with the transgender bill that was introduced last year, and I imagine that's an act, there was a lot of resistance within the trans community. Could you tell us what that resistance was, and why was there opposition to the law, and how do you think that law will play out in the coming days?
See, now, I think to give you a context, there was this Supreme Court judgment in the year, I think it was 2014, if I'm not mistaken, which kind of granted rights for transgender people in this country, saying that fundamental rights has to be there. And then because of that, Tirusri Shiva was the first person, a DMK member of Rajya Sabha, kind of introduces a private member's bill. Then we saw one MP from West Bengal in the Lok Sabha introduce a private member's bill. Then the government said, no, we will kind of bring in our own bill. There was one version, again, which received a lot of flack from the communities because there were no consultations which were taken place. I think one of the issues which we face in India is when you make laws and policies for marginalized communities, you don't take them into account. So they never play a central part in terms of making policies. So it's always normally a top-down approach. So then the final bill came in, again a lot of agitations happened, and finally, because they had good majority, they kind of went in, and now it's become an act. So there are a couple of issues with the transgender persons. Act. Now, the first issue is there's absolutely nothing vis-a-vis reservations, which they say, and even vis-a-vis welfare measures. I think they say that we will allocate roughly about 10 crores or something, and then we will kind of look into that. That's one. And the third thing is they also mention the screening committee. Now, basically, they say that, no, how do I know whether you're really a transgender person or not? So there has to be a screening committee. So to avail your transgender identity card, you need to go through a process of screening. Now, the question is, do other citizens of this country go through a process of screening? So why this for transgender community? And how are you going to dictate whether this person is trans person or not? And that has been one of the major issues which the community said that no, we will not have any kind of screening committee. So that was the thing. So the act was there, but the thing is that as of now, you're not got into the rules as yet. So once the rules gets framed, probably you should see there how we kind of engage to see what kind of rules will kind of get formulated based on the act, because the act is one part of it. The nitty-gritties, the nuances are going to be in the rules which will get formulated. So then we will see as we go forward, how do we kind of take this forward? So yeah.
So, do you imagine that with processes such as screening and identification, this community, it's already criminalized? Do you see that it will be targeted even more?
I think it will be targeted, no? Because, now you're not criminalized per se, but you will be targeted as a community because it's easier to target these communities. To kind of give you one example, in the United States of America recently, there was a pastor who said, oh, coronavirus and all happening, it's because of people like LGBT people. So, already there are statements like these, because of LGBT people, you have coronavirus. So in some parts of the world, the budgets which are meant for LGBT community members is kind of taken back or reduced. So you're already seeing some level of impact. And you had the Human Rights Watch, I think a week before or something, that came out with a statement saying that no, this should not be the reason to kind of pull back schemes or some sort of welfare measures which are meant for these communities. Okay. So there's already these kind of statements which are kind of being made. I think in some part of the world, there's some religious leaders which made, or because of people like us, LGBT community members, the God is angry, and that is why we are here with coronavirus. So these kind of absolute rubbish kind of statements are also being given in a few places.
One of our viewers, Vijay, says that like the migrant worker issue has been catapulted in our collective consciousness, what will it take for the larger society to look at trans and sex workers differently post-COVID?
I think as a migrant workers, because of the scale and the enormity of the issue, because of the scale of the issue, and then you had already probably seen in television channels in terms of people walking for miles together. So I'm actually worried, should this also happen to the transgender community and the sex worker community, for the consciousness of the government and for the nation to be woken up? So I know I don't want that kind of a situation. All you want, like, sex workers and trans people to die, and then suddenly you realize, oh no, this is what had to be done. I think before that, I think it's better to kind of start kind of planning. As I said, there have been some kind of government policies which I've already mentioned. A couple of minutes back, I also told about there's been one directive in the government of Karnataka. The National Commission for Women, incidentally, is written to the government saying that no, sex workers should also be provided relief and support. So all that is good, but I think the whole issue is at the implementation level. Even today, we are seeing, for example, in relation to migrant workers, they're positive, but at the implementation level, we all know in the ground, like, what are the issues which are kind of happening in terms of access, in terms of that. So my thing is just either universalize your public distribution system and just say that people whoever are hungry, irrespective of their ration cards, start distributing dry rations. You're sitting in tons and tons of food grains, which are also in surplus what you would need for your entire year. There are economists like John Drays and others who kind of said that use NIT, open up your mandis and start delivering it. One way to think about this universalization of food grains, or start giving food grains. It doesn't take much. It just requires probably one notification from the central government, irrespective of whether I have a ration card or not. I think we should start kind of supplying. See, organizations and NGOs can only play to a certain limit side. Even we do have our limitations. I think it is also the responsibility of the state to also kind of take up on them and start providing benefits.
So clearly, the government needs to do more.
Yes, certainly.
So do you imagine, as Anukriti is asking, do you anticipate that given the kind of poverty we're going to see in the next few months, do you imagine an increase in human trafficking and therefore in sex work?
I don't see that happening, because at least in terms of this, but I said there's always this conflation. Because when poverty indicators kind of go down, you'll have an increase, but I actually don't see that happening, because in terms of the way this pandemic is kind of evolving, and I don't see that happening in terms of human. Look, at the end of the day, human trafficking is a crime and it's horrible, and we are very clear with that in terms of human trafficking. And in terms of that, and we keep saying, even though we keep saying that sex workers are better placed to also deal with trafficking. There's this brilliant case study to kind of give you an example. I think in one part of this country where this organization kind of Sangama, there's a sex worker who had come in from Nepal to one part of Maharashtra, and later sex workers there found out that she was forced into this. They collected their own money and they accompanied her till Nepal and left her and came. So we always say that even to deal with trafficking at a larger level, you see sex worker, because sex workers are better placed, and sex workers have been doing this for decades, and they have stopped many cases of people who are forced into sex work. They are being taken away from sex work and are being kind of left. So I think there are examples of these. But the problem in terms of popular culture, popular imagination, this constant conflation between trafficking and sex work, and then seeing either you are in these two binaries, one binary which sees sex workers as inherently everybody who's in sex work force. I think it does a lot of injustice, because we are taking away the agency of that person involved. Because when a person is doing sex work in own volition, because it's any other form of work. But more and more, if you start unpacking this whole issue, it's basically to do with morality, because sex is always seen as something as sacred within the construct of family and within the construct of marriage, and sex is not seen in the lens of labor, in the construct of monetary kind of exchange. And then you tie it up with morality, issues of morality, and I think that is where this stems from.
So you in fact are making multiple points.
Yeah.
So you're saying that sex work often happens not just because there's pressure from outside, but because there are many women willingly doing it, and
yes.
that human trafficking doesn't necessarily equate to sex work, but could have many other consequences.
Yes.
Now, but there are several communities who are in sex work because of age-old practices. In Karnataka, for example, we have Devadasis, or in other parts of India, we have other caste-based forms of sex work. These are thrust upon women, and they have to enter this profession involuntarily. Would you say that do you think that this has reduced substantially, or this is a lesser percentage of sex workers as compared to?
No, that is reduced substantially, and I think we are talking about only people who are voluntarily getting into sex work and with their own agency. Now, even if you look at Devdasi, there are also other narratives of the Devdasi communities, which are kind of coming in. So our premise is this, right? So what used to be old age and now people forcing into sex, no, now that is reduced. And here I'm only talking about sex workers who see it as more lucrative, who see this agency in sex work, and people who have experienced other forms of labor and who have kind of come into sex work. And they're sex workers once they become, and they're not sex workers always. Some of them do other forms of employment also. It's some of them do it seasonal, some of them are government workers, then they also do sex workers on the weekends or evenings. So there are also this multiple kind of forms of labor kind of also kind of intersecting.
Okay.
So just to kind of clarify, our organizing is where we see sex workers who are about the age of 18 who get into sex work on their own volition, who continue to stay in sex work in their own volition.
Okay. Yeah. So given, let's say that you define sex work in your interventions as those who are organized or those who enter out of their own volition. Do you think it's ever possible to have a union of sex workers, as our viewer Arindam is asking?
Yes, I think that's a brilliant question. In fact, as Sangama, we rather helped start the first trade union of sex workers. You had the Karnataka Sex Workers Union. But the problem, I'll tell you, it has not been registered, recognized by the state, because there have been issue of who's the employer-employee in terms. So our case has been filed in the labor code. So we are on a legal struggle of recognizing sex workers as workers and unions. I absolutely agree. The way forward is also to go towards unionization of sex work, because you need to have collective bargaining power and the collective voice of sex workers.
And should sex workers be unionized, or if there was a large collective of sex workers across India or transgender people across India, do you imagine that would help them get access to entitlements during this pandemic? Do you think this pandemic is also an opportunity to collectivize the entire community?
Yeah, that's what we're doing. Absolutely, Rishabh. Because see, one of the things which we see in our activism, but also in all of in the civil sector, the more you're organized, the more you earn numbers, then your governments listen. And I think that's when, and probably, I think this is also one opportunity for us to kind of go toward exactly what you're saying. I think we're also seeing this as an opportunity in terms of how do we kind of relook at different forms of organizing, how do you strengthen communities, and how do we kind of take it forward.
Right.
Because if you're not organized, if you're not collectivized, rights are not going to come in this country or any other country so easily, because every civil rights movement, so whatever gains you have made, for example, the decriminalization of same-sex behavior in India, the reading down of IPC 377 happened because of more than a decade-long struggle in India. So,
okay. Clearly, there's a lot of focus on universalizing social entitlements. And do you think this community will benefit in the long run if a lot of their social entitlements were universalized?
See, in terms of social entitlements, yes, I think we have to kind of think through universalizing the entire social entitlements. Yes, but there could also be certain kind of vulnerability, certain kind of entitlements which also has to be tailor-made. So it also kind of take that into account. I think this needs a more kind of thinking through within the communities.
Could you expand on that? What do you mean?
I can give you my perspective, but this is not being kind of taught through within the communities in terms of entitlements, whether you want to kind of universalize entitlements. For example, if you're living with HIV, then in terms of their specific issues or specific entitlements relating to people living with HIV, for example. So how does that get tied up into when you kind of universalize entitlements and make it one kind of standard across communities?
Right. My final question to you before we close for today is, given that this community is extremely on the margins, they are facing violence, mental health issues. What do you imagine as structural reforms for this community, and what could we do as citizens to support these communities?
In terms of structural reforms, I think one demand is decriminalization of sex work, complete kind of decriminalization, because criminalization just doesn't work. So you need to go towards decriminalization of sex work. The second thing, then after that, probably see them as workers, bring them within the ambit of informal labor, unorganized work, for example, and kind of take it from there. For gender and sexual minorities, for LGBT communities, there has to be a lot of kind of structural level kind of changes which has to happen. Now you have the Trans Act in spite of certain issues. So at the policy level, you need to see governments more kind of effectively taking a kind of important role in terms of bringing these issues of these communities, whether in terms of access to health, for example. Governments should start providing sex reassignment surgeries or gender affirmation surgeries free of cost in government hospitals. So either in terms of and also access to work and livelihood is other important thing. Now post the lockdown, I don't know, because with the present economy and the sector where there will be more kind of work, will people still want to employ trans people and people based on sexual orientation and gender identity, because access to work and livelihoods are also kind of an important kind of area which we should kind of see. And I think the final thing at the larger structural level, which the pandemic has taught us, just not as pandemic, but time and again we're seeing that I think you need to go towards more kind of, the government should spend more on public healthcare systems rather than strengthening private healthcare systems. I think India falls short, abysmally low, if you compare even to Sri Lanka and Pakistan and other parts of South Asian countries vis-a-vis health indicators. So you need to focus more on public health and public healthcare indicators. And I think one of the things with pandemics like these over decades across the globe has taught us is when pandemics happen, probably there will be a new change in world order. Let's hope that there be a positive change in the world order itself, and how do we kind of move ahead from here. So there are many lessons to be learned from this pandemic.
And what
the issue is just not the virus, but the issue is other kind of structural issues and what has really been happening. So
and finally, what can we do as citizens to support these communities?
I think as citizens, one of the things which I keep saying is respect individuals who they are, irrespective of what their identities are, and respect them and kind of give them dignity. If you come across LGBT people within your families, your neighborhoods, or anywhere, kind of listen to them, and they are as normal as I think I'm as normal as anyone else in the society. So sex workers are also workers. So see them with respect and dignity. I think once when we start to see these changes, then most of the problem gets solved.
Thank you so much, Rajesh, for joining us.
And I think it's a privilege that I was called into for this discussion. So, yeah.
Thank you. Thank you so much.
Thank you. Thank you so much. Thanks.